Assalamu alaikum. In this video I discuss diagnosis images which are used in the practical portion of the first professional examination. This is the list of diagnosis image student have to understand and prepare for examination. So for two picture the 10 marks is allocated, uh, one figure 5 marks, another figure 5 marks. These are board-wide distribution of the diagnostic images, and in each images you have to identify the modality of the image. Following are the modality of the image: plain X-ray, contrast X-ray, CT scan, MRI, ultrasound, endoscopy, colonoscopy. And number 2, you have to identify the plane of the image. These are the common plane used in diagnostic to describe a diagnostic image: axial, uh, sagittal, coronal. In CT scan and MRI, similar to the body plane of the body. View of the image: posterior anterior view, anterior posterior view, oblique view, lateral view, occipital mental view. And type of the image: plain or contrast in X-ray. And you have to identify two structure in the X-ray: radio opaque and radiolucence. One radiolucence structure. In CT scan, the one isodense, hypodense and hyperdense structure, and in MRI, isointense, hypointense, hyperintense structure. And in the fourth number question, you have to um, describe the relevant clinical implication of modality. Normal structure আর চেঞ্জ যে কারণে ইমেজে চেঞ্জগুলো হয়: ইনফেকশন, ইনফ্লামেশন, টিউমার. দিস কন্ডিশন causes changes in the normal structure: distortion, disruption, fracture, obstruction, foreign body accumulation. This thing can be understand by seeing these diagnostic images. So this is the final look checklist. You have to say the modality of the image. You have to say the site type on plane of the images, modality, features, structural features, relevant clinical implications, and total marks is 5. And for two figures there is a total 10. For each board 1 you have to diagnose two figure. In board 2 you have to diagnose, you have to describe two figure. So this is the X-ray, the from black to white. You have to use these two terminology to describe plain X-ray: radio opaque and radiolucent. Radio opaque means white, and radiolucence means less dense, darker on the radiograph. So here is the most darker structure in the plain X-ray, and bones and metal are white in plain X-ray. So this is the complete description of a plain X-ray: chest, posterior anterior view. So the modality of the image: X-ray, and you get one number. And plain X-ray, that is no contrast is used, so you have to mention this is the plain X-ray, and you have to mention the view, the posterior anterior view, so you get one number. And modality features, you see the radio opaque structure are the bony structures: ribs, clavicle, and there is a radiolucence structure also present. the trachea, principal bronchus, lung, carina, funding gas. So you have to identify any two structure, and this is the bones see within this diagnostic image. These vessels are seen within this viscera. This viscera is seen this special um, area of figure you have to describe, and you also describe uh, by using this type of figure you can describe a infection, inflammation, distortion, disruption, any bony fractures, any tumor, any obstruction. So this is the total answer of a diagnostic image. In MRI scan, you have to tell the MRI of the hip joint, and you mention the view, coronal view, and you also describe according to this terminology hyperintense, hypointense, and isointense, and you have to identify any two structure or feature. Mm, and this is the structural feature: bones and joint, muscles. So you have to identify any two features selected by your examiner, and these are the um, relevant clinical importance you have to ask, or you have to tell about these diagnostic features. In CT scan image, you have to tell the CT scan of the brain, and no context um, is used in this figure, in this image technique, and sagittal section is used here, and you have to describe the different structure of this diagnostic image by hypodense, isodense, hyperdense, and you have to identify following structure, and examiner asks any two structure, um, and tell you to identify this structure, and also asks the relevant clinical importance of this modality. So this is all about the how you interpret diagnostic image in your practical examination of first professional examination. Um, if you find this video helpful, please share this video and please subscribe my channel. Thank you for watching.